Hi, I'm John Kuhn, student physical therapist, and today I'll be showing you how to do a sliding board transfer from wheelchair to bed and returning while maintaining precautions. These transfers are done for patients who cannot do a standing transfer or are unsafe to do a transfer on their own. We'll be looking at these three precautions: a patient who has hemiplegia or hemiparesis, sternal precaution patient, and a patient who has had a spinal fusion. Please refer to skill 21 for positioning the patient in the wheelchair for the transfer, and skill 17 for proper wheelchair setup, and skill 23 for proper dependent and assisted sliding board transfers. A patient who has hemiplegia will not be able to move half of his or her body, and a patient who has hemiparesis will have weakness in half of his or her body. This transfer can be performed in two different ways: either having the patient move toward their weak side, utilizing their strong side to move by pushing away from the wheelchair, or moving toward their strong side, pulling on the sliding board to do the transfer. Okay, Bernadette, what I'm going to have you do is put your right hand up here on a wheelchair and push away with your strong side, and I'll help guide this leg. All right, on the count of three, we're going to move. 1, 2, 3. 1, 2, 3. 1, 2. If the patient is moving toward their strong side for the transfer and utilizes the hand cutout, they'll have to be careful to not pinch their hand when bearing weight on the sliding board. Okay, Bernadette, what I'm going to have you do is use your hand here, your strong side, to pull yourself toward the sliding board and push off with this leg. I'll help you move this side of your body. All right? 1, 2, 3. 1, 2, 3. 1, 2, 3. For a patient who has a sternal precaution, they will not be able to perform the push-up portion of the transfer. So we'll have to modify the transfer accordingly. We'll have the patient cross their arms across their chest, holding a pillow, shift their head and shoulders anteriorly into the healthcare professional, and we'll be grabbing at the hips for this transfer rather than the gait belt. The patient may have also had a coronary artery bypass graft that utilized the saphenous vein in their leg, so this leg may be painful and swollen from surgery. So we want to make sure that the leg is in a position of comfort so that it can be used to bear weight during the transfer. Okay, Bernadette, what I'm going to have you do is cross your arms across your chest on this pillow. Make sure to keep this leg in a position that's comfortable for you because of your recent surgery. You're going to lean into me, and we'll go on the count of 3. 3, 2, 1. 3, 2, 1. For a patient who has had a recent spinal fusion, they should avoid twisting at a level above or below the level of their spinal fusion. They should also avoid any excessive bending at the level of the fusion. In this example, the patient has not had a cervical spinal fusion, so they will be able to twist their head during the transfer. Okay, Bernadette, what I'm going to have you do is try to avoid twisting your spine